So those are the religious leaders from the Cameroon, so members of the press, if you want to pull them aside and ask them those tough questions.
The USA Global Official Development Assistance ODA cut on US aid fundings are not positive on African faith healthcare programs. African Christian faith leaders convene in Nairobi, Kenya to respond to these impacts.
2.5 days, and they agreed on key principles and issued the public statement. That was a big milestone. So that frames a conversation for all of us moving forward so that we know what we're supposed to work on, because these leaders have got together and say, here's the agenda.
For 3 days, these leaders and their health executive from 10 countries have analyzed the ODA cut, discussed its implications, and arrived at a statement that reflects their shared values and priorities.
We can say that we have done that. We have put together a unity statement, which means we are all on the same place about what is happening, and we are also on the same page about what we need to do as the church, as well as what we need to ask donors, governments, parliamentarians to do.
The ODA cut have impacted PCC's community social health programs in Cameroon, creating concerning gaps in social health care delivery.
And for the Presbyterian Church in Cameroon, we are suffering from this curse, especially in our HIV units. They are suffering from this curse quite much because it has affected a lot of our community health volunteers. They will go back very hopeful.
The PCC is committed to catalyzing local advocacy and initiate faith conversations for corresponding national and regional health policies.
We from Cameroon, I'm here with the Baptist Church, I'm here with Prof, the Anglican Church. We have also discovered some of our deficiencies, which we have learned from this consultation, especially in the area of opening a platform for Christian Health Association for Cameroon, which if we go back, we sit, we bring to the table all these things, we try to see how to meet our governments. I think the health situation in Cameroon.
The Cameroon delegation left the conference with a resolve to amplify the message through diverse networks.
The 5 of us from Cameroon already agree that we are going to have a consultation of this same nature back home, where we will cast the others and we will bring the others on board so that we continue to contextual realities now on how we can cope and curb this gap. But I must thank PCC TV for being everywhere.
Being healthcare leaders, we need to think differently. We need to see how we can mobilize local resources, how we can even rethink the way our healthcare system delivery is functioning, and see how we continue to be sustainable, how we continue to bring the much needed care to the people that need it the most from us.
The take-home message is that we are going back, especially the delegation from Cameroon, the PCC, the Anglican Church, and of course SEC. We're going back to sit down and begin to plan on strategies on how to be able to overcome this situation. Of course, we're also going back to continue to advocate, do a lot of advocacy, and of course continue to engage our government to see how together we can collaborate to see that the health sector is not affected.
So this is the Desmond Tutu Memorial Hall at the All African Conference of Churches. A while ago, it was quite busy with delegates from 10 African countries, religious leaders, who have been here to share the outcome in a press conference following the deliberations of the 3-day conference that they held on how to look forward to generate resources to be able to curb the cuts in the development health sector, basically from the US and other European funding partners. So they have been able to deliberate, and the hall is now empty as a visible sign to show that all is well, that ended well out here in Nairobi, Kenya. And The delegates are going back, looking forward to implementing the resolutions that they have had here. And basically, in Cameroon, the delegations are planning to restitute the outcome of this conference. And we're looking forward to new opportunities and more sources to fund the health sector of African Christian health organizations.